So, good afternoon, everybody. My name is Breck Rice. I'll be your host this afternoon for the mini More Profit Community Pharmacy Roundtable. Absolutely love community pharmacies. I'll do everything in my power to help you be successful and profitable. And uh, we I do a full hour-long roundtable once a month on the second Wednesday of each month. So the next Wednesday, a week from now at noon Eastern time, where we go into a lot of front-end products and things to help boost the profits for community pharmacies. And somebody asked me, how come you only do it once a month? Well, it takes a lot to coordinate and get out all of the, uh, all the different vendors and people that come on to support that roundtable more than once a month. But we do this once a week at 4:30 Eastern, 1:30 um, Pacific time, to help those that have pharmacies that are looking to bypass the PBMs and make more profits. So my background has been, working with community pharmacy for over 20 years, about 22 years now. Love the industry. Will do everything I can to help pharmacies be successful. One thing that I talk about all the time is bypassing the PBMs. As you can see from this slide right here, the PBMs and the insurance companies are aligned against community pharmacies right now. Their goal is to put you out of business, and my goal is to keep you in business and help you be profitable. So I've gotten involved in the PBM reform. I host the PBM reform podcast on the Pharmacy Podcast Network. I hope you're all subscribed to that, and then do my more profit roundtable so that I can help pharmacies in that way as well. So what we want to focus on in the next 20 minutes or so is these three steps right here. Step one, which is what we're going to spend the majority of the time talking to George Veronis about. And some of you consultants that are on the phone, hopefully I got the letter that he's, officially gotten the big promotion. So the Vice President of Sales and Marketing, George Veronis for Seniors Home Services, will tell you all about their wonderful program. And then I will uh, just touch on step two, which is getting fully credentialed on the medical side to bypass the PBMs by expanding your scope of services. And then step three is a fully run and managed and staffed clinic for your pharmacy. The pharmacy owns it, but it can be managed and run for you. But let's first talk about this remote therapeutic monitoring, because what an opportunity for community pharmacies. I've never been this excited about the opportunities after seeing, almost 20 years of pharmacies being beat up by the PBMs and not being able to even afford to dispense medications anymore. These are some opportunities on the clinical side that will really help community pharmacies, and remote therapeutic monitoring is one of those opportunities. It is an amazing program that is needed. The seniors need this, and it's a way for the pharmacy to make pure profit off of the administrative fee that's going to be paid to them from Seniors Home Services. So, welcome the new Vice President of Sales and Marketing for Seniors Home Services, George Veronis.
That sounds like I need a vacation already.
You are on vacation. You're in
Oh yeah, yeah.
Scottsdale, Arizona.
I am in Scottsdale. Well, thanks everybody. I appreciate your time. And this is a 15-minute total presentation at this point. So I'm going to show you a couple of videos that'll explain our program better. And then Breck will come on and tell you steps 2 and 3, and then we can open up for some questions. So let me start with you see my video there? Oh, yeah. Let me start with
Yep.
the page here that says, for your patient, when they see this program, it's going to be all about improving memory, balance, cognitive stress, decision making, and better quality of life. So the one comment we get from all the pharmacists is, wow, what a great program that could really help my patients live their golden years much better. And everybody knows you never want to fall, because that's the first step towards going downhill. And we also obviously want to have good memory as we age. And then to the pharmacist, you basically, for administering this, takes about 1 minute per patient. You'll make $2,500 per month per patient. So our goal is always 100 patients or more. That's about $2,500 a month. It's turnkey. There's no additional staff and no capital. And we're at this show here with a lot of the chains, and we're showing them, and they love the concept because, again, it's no cost. So let me show you the first video, and then we'll go from there.
It's no secret that pharmacies are under financial stress today and need to find new sources of revenue within their existing businesses. Seniors Home Services is happy to introduce you to our Remote Care Today program that can provide tremendous benefits to your customers and new revenue for your pharmacy. Our remote care service is clinically proven, done over tablet or smartphone, and a Medicare reimbursable program that can help prevent, treat, and often reverse chronic illness, musculoskeletal disorders, memory loss, cognitive regression, and loss of balance, thereby slowing decline while helping prevent falls and loss of independence. Our remote care services are backed by years of success in improving patients' quality of life, helping them remain independent for as long as possible. You can make these services available to your patients as we provide a turnkey solution, including patient engagement, enrollment, support, and Medicare billing, under our Medicare NPI. Our patient engagement process is easy and fun with our complimentary Turn Your Selfie into a Healthy app and does not require any additional work for you or your staff. This biometric facial scanning app, which we personalize to your pharmacy, uses smartphone facial scans to read blood pressure, heart rate, oxygen levels, and risk factors with incredible accuracy, engaging patients in their own health by knowing their numbers, anytime, anywhere. We also provide posters and bag stuffers with QR codes. As people use the app and receive results, they naturally engage with our support team and learn all about how our services can improve their quality of life. Information on your patient's monthly progress will be available in our secure portal, and if you choose to review their assessments each month, you can earn administrative services fees for the time you spend, all while helping your patients live better and longer.
So that gives you a good little summary. And Breck, why don't you go through the 3 buckets for remote care for pharmacies, then I'll come up and I'll show a few more things.
Yeah. So one of the benefits of working with Seniors Home Services in their remote care today is that besides the remote therapeutic monitoring, they also have vendors that help with the chronic care management and the RPM. We just call it remote patient monitoring, but you can see that I've always been referring to it in the wrong way. It's actually remote monitoring, but nonetheless, I'm going to interrupt right now to introduce my good friend Jessica Jones. She's going to say hi because we see that one of our best friends is on here, Hashem. So Hashem, good to see you, my friend. It's awesome to have you here. So Hashem is a rock star in community pharmacy for those that have not met him before. So you're a rock star.
Like the spotlight, but he's wonderful.
Yeah, good to see you, my friends. I told Jessica because we're out here at the NCPDP conference in Scottsdale. So of course we're headquartered here in Scottsdale. So we like it when the conferences are here. We don't have to travel. But back to the point here. Thanks for entertaining my little interruption here. But the here I'll even show you my name tag. It says I'm disruptive there. So sorry, that's my name tag. But yeah. So the benefit of working with seniors on this is that no one vendor can bill Medicare for all 3 of these services. You can do, CCM and RTM, but you couldn't add the RPM, or you could do RPM and RTM. You just can't do all 3. But Seniors Home Services has a collaboration with multiple vendors, so you can actually do all 3 services. We are going to focus just on the remote therapeutic monitoring today, because this is absolutely low-hanging fruit for our pharmacies. I like to call it mailbox money for our community pharmacies. So back to you, George.
Yeah, so thanks. So we're going to focus again on RTM more than anything here. And I'll play you a little video just so you know exactly what RTM is.
Remote Therapeutic Monitoring, RTM, is a clinically proven and Medicare reimbursable program that not only helps recovery from accidents, but can be directed to help prevent and often reverse memory loss, cognitive regression, and loss of balance, thereby slowing decline and helping prevent falls, as well as helping with stress, anxiety, working memory, concentration, decision-making, and emotional control. In addition to the physical improvements patients can see, these programs can improve plasticity, which will improve patients' quality of life, helping them to remain independent for as long as possible. We are pleased to make RTM available to your patients and make it so easy as we provide a turnkey solution, including patient support and Medicare billing under our Medicare NPI. Introducing RTM to your patients is easy as we do the entire introduction and education for them. We'll send them a landing page, which can include a short video message from you, as well as educational videos, and then give them the opportunity to enroll right there. We'll also reach out by phone to assist with the enrollment process. When they enroll, our coaches personally call by phone to welcome them and send a welcome email with logins to their personal customized programs. Their personal coaches are available by phone as needed to help them along the way. As with all our programs, we take care of all patient support, coaching, encouragement, and all billing. Remote therapeutic monitoring can have a major positive impact on your patients without creating any additional work for you or your staff. Just click the Get Started button on this page to begin.
So again, that gives you a little idea of the remote. And then I'll show you, there's going to be several services under the RTM platform that you could take advantage of and get Medicare and Plan B and A advantage to pay for. But one of them we're going to focus on something called Brain Savers. And I'm not going to show this whole video. I have like 1 minute of it just to give you an idea of what the seniors will see. Whoops. Let me start that because we have no voice. I'm going to figure out why I had no voice here. Hold on. Oh, here we go.
Brain Savers is a pioneering, evidence-based lifestyle program designed and developed to promote healthy brain aging and reduce the risk of what is currently the 5th leading cause of death, and that's Alzheimer's disease. I'm Dr. Paul Bentheim. I'm a neurologist, and I led the development of the Brain Plus Body Total Lifestyle program.
I'm Dr. Gina Touch Mercer. I'm a geropsychologist.
My name is Angie Moore. I'm Programs Manager for Brain Savers.
I make up several of the brain workouts and many of the lessons on cognitive fitness, socialization, and stress management.
My focus is developing the physical fitness aspects of the class, as well as the segments of the class that have cognitive and physical.
So George, you're buffering pretty hard here with our Wi-Fi at the hotel. Just move on. George.
Can you hear me? Breck? I think he
I can now. Yep.
I don't know if
Yeah, just move.
Yeah, that's
Yeah,
right.
just move on.
That gives you an idea. Let me get back to my presentation. So the reality of it is, we're going to help your patients in the key areas of obviously memory, and all cognitive issues, and then also on balance. So it's a big market. And then, doc, the thing that all the pharmacists want to know is, what is the time frame? What do I really need to do? So it's as simple as this. This is a 30-second video, and this will show you exactly what you have to do as a pharmacist to get a service fee where we're paying that $25 per patient. So let me show you that.
Working with our program is easy for you and your staff. If you choose to review your patient's monthly progress and earn administrative services fees, you will be sent a weekly email notification reminding you to log into your portal and review patient assessments. You or an appropriate member of your staff will review these reports, review the summary data for the patient, add your notes, and then simply click the sign-off box next to the record. It's that easy, and it's that fast.
So that's the process. And then, we're going to help market this with you, and we can do all the marketing. So you have a couple of choices. We either give you bag stuffers, posters, like you saw in some of the videos. We have a Selfie Healthy. Inside it, you put a little 20-second video saying, "Hi, I'm Dr. Jones. Here's a program I highly recommend for as a senior. Watch this video below." And then it'll come through text or email or phone call. And if we reach people, you usually get about 80% that want to participate in the program. And that's pretty much it. The Selfie Healthy itself, I'll show you just like 20 seconds of this so you hear it, right? So you can see how we're going to market for you. And if you give us your database, which is all HIPAA compliant, as you cite a BAA, then, you know, we will get to your people a lot faster, which means we'll put 100 people or more on a lot quicker, and then everybody wins, including your patient. So here's just a little bit about the Selfie Healthy program.
In today's healthcare environment, one of the biggest challenges for medical providers is engaging patients in proactive care. It's hard to convince someone they need help when they don't even recognize the signs. But what if there was a way to make the need clear without you having to be the one to do it? Meet a revolutionary solution for patient engagement: AI-powered facial recognition. We call it Turn Your Selfie into a Healthy. Imagine a technology that helps your patients track their health, identify risks, and stay engaged in programs like our health and wellness coaching to keep on track with their health, all without you having to perform the assessments or having lengthy discussions with the patients. This advanced technology provides an easy-to-use, self-guided experience for your patients. They can complete assessments from the comfort of their home, gathering valuable data on their own through a 30-second AI facial scan using their smartphone. With 96% accuracy and 98% repeatability, it can analyze metrics like heart rate, blood pressure, oxygen levels, health risks, and others. This is not a substitute for medical care, but it is an accurate way to identify symptoms that just might help your patient recognize the need for lifestyle changes and to make healthier choices with diet and exercise. In addition to the immediate on-screen results, a detailed report is also generated, which we will review with the patient and educate them on how our remote care services can be so helpful. It could also encourage them to become more engaged with our proactive cognitive improvement program, designed to improve both memory and balance. We provide marketing materials like posters and countertop materials. As people use the app and receive results, they eagerly engage with our support team.
So that gives you an idea of the Selfie Healthy, which you saw a little bit in the last video. And Breck, before I turn it over to you, basically, if a pharmacist on this call is interested, we send you an agreement. Again, we do all the marketing for you. We do basically the whole process. We talk to your patients and we get them on the program. And this is basically all you have to do to get started. And then, Breck, I'm going to just go right to that part and I'll turn it over to you.
As well as for buy programs. And to get started, our agreement, next steps are easy. First, complete our agreement and sign the BAA, which ensures HIPAA compliance. And then we'll schedule your onboarding meeting. During this meeting, we'll discuss how we engage patients and the materials we can print and provide you that help patients engage with us. We will then educate and onboard your patients using approved text messages, emails, and friendly phone calls, providing the patient the appropriate programs and coaching, all without any cost to you. Your pharmacy then has the option to provide monthly data reviews for each patient, which earns you monthly administrative service fees. Better patient health, new revenue for your pharmacy, improved patient loyalty. Let's get started.
So, Breck, you know, that's basically it. It's a program that we've almost have 100% success rate with pharmacists looking at this and wanting to add it to their thing. It's pure profit, as we said, not really revenue because it's profit. And I know when they make that extra 2,500 or 3,000 or 5,000 a month, they obviously have a couple of choices to do with the money, but also what it leads to a lot is your medical billing platform that is obviously bigger dollars coming in. So I'll turn it back to you and you can explain the last two parts and then we'll wrap it up. So thanks everybody for your attention.
Yeah, appreciate that, George. And just to be clear, you know, IPVN isn't my company, Independent Pharmacy Provider Network. I just advise them and have them on my More Profit Roundtable because I've been looking for a solution because as I mentioned earlier, I've seen so many of my pharmacy partners go down, you know, paths with good intentions, both on the company side that was trying to help them get credentialed and on the pharmacy side. But so many got started and never got across the finish line, but after spending thousands and thousands of dollars. So these four pillars here are the keys to success. And we found out really quickly on in the last 2 years in reviewing all these programs out there, they're also the keys to failure if not done correctly or not have one of them in place. Number one, you've got to have a turnkey software system in order to be able to do the patient engagement, clinical notes, and billing and collections. Number two, you have to have a CPA. Even though there's some great programs out there like Outcomes and CPSN, that are helping pharmacies operate at the top of their license, that's great. That's awesome. It's still all services inside the pharmacy. And so you're always going to have the PBMs, getting their greedy hands into your pocket and taking some of those profits. So having a collaborative practice agreement and setting up the clinical services outside of the pharmacy, same address, just a new entity, is really one of the keys here. And then IPPN even helps you recruit those providers. You probably already have some doctors that you've got a great relationship with, so that's the first ones you start with, to be an extension to their services, because they're so busy they only have time to take care of sick patients, and you can help them improve their quality measurement scores with CMS by providing the well care checkups, annual wellness visits, diabetes screenings, heart health, even the RTM program that George just talked about, is that remote therapeutic monitoring. That cognitive thing is one of the lowest scores with all the doctors. They're not doing those cognitive checks like they should. Then the last pillar is you got to know what you're doing when it comes to billing insurance. I've been in insurance billing for 22 years, and I got to tell you, those payers have everything working against you to pay you. They're going to try to figure out every way to deny that claim. And if you don't know what you're doing, if you don't have the right modifiers, you're going to get stuck like my one pharmacy friend who it was sitting on over $100,000 worth of clinical bills that he couldn't collect on. So you need to know how to do that. Next slide, George. Here's just an example of some of the CPT codes that IPPN would help you set up so that you could do preventative visits. So it's basically the 99391 through 99397 for preventative, then all the codes for office visits, and then eventually even diagnostics services as well. This will basically add an additional $300 to $1,000 per patient in new profits to your pharmacy. So next slide. The last thing I'm going to just touch on is, and this is phase 3. This won't fit for every pharmacy, but for those pharmacies that do have room for it, you can have a complete brick and mortar clinic right there at your pharmacy. So you may already have a room set up. If you don't, you can build out a clinical room. It needs a footprint of about a 10 by 12 foot space, but you own it. The pharmacy owns it, but it's run and managed by Brim Wellness. This expands your scope of services well beyond even what you're doing with IPPN, and they'll manage it and even staff it for you. I love the talent exchange program, because why pay for an FTE if you don't have patients to be seen that day in the clinic, or have to split your time as the pharmacist between your pharmacy and the clinic? They'll even staff it for you. It's kind of like Uber for nurses. So it's a great program. And then the third leg of this stool, I really love, because it's a financial vehicle that not only helps the pharmacy get the build out done, get all the equipment in, but then the pharmacy can be a cooperative member of the pharmacy fund. You will be helping other community pharmacies get their clinics set up, and then earning a really awesome, amazing return on your investment in that pharmacy fund. About, I don't know, 10 times what the banks are paying on interest right now. So that's the exciting part of the Brim Wellness. So George, why don't you wrap it up with the last slide here and tell people how to get started.
Sure. So look, again, just how we started, it's a great process for your patients. It's great for you for extra income source. And obviously, it's someone asked you to come on this call today, so you just get back to them and they'll get you the agreement and answer any other questions you may have. And you feel free to stay on a couple minutes now. If anybody has questions for Breck or myself, we'll answer your questions. But that's really our presentation. I know this feels very simplistic and easy, but it is. And again, we have so many pharmacies that we just got started. So we have probably about 200 pharmacies that have signed the agreement that are going to be in the process of getting started rolling in the next 30 to 60 days. So we look forward to working with you also. So with that, Breck, you can stop the video if you want, and then we'll go to some Q&A.
Yeah, and I just want to thank all of our community pharmacists that have joined us. I was, giving props to Hashem, our friend, for being a rock star, but all of you community pharmacies are rock stars. So thank you for joining us and being a part of this program this afternoon. Would like to open it up for any questions at this time.